Welcome to the UT Healthies Texas Virtual Education Series. Today's presentation topic is the importance of preventive medicine, featuring Dr. Christian Ferrer, board-certified family medicine physician at UT Healthies Texas Physicians in Quitman.
Preventive medicine, we usually talk about in three levels: primary, secondary, and tertiary. Primary is an intervention implemented before these evidence of disease injury, and its intent is to reduce or eliminate causative risk factors. The example here is encourage exercise and healthy eating to prevent individuals from becoming overweight. Another example of this is with the public health department intervening to help prevent exposures or prevent diseases. For example, by adding fluoride in the city water to help with tooth decay and prevent cavities in young children. Secondary prevention is an intervention or service implemented after disease has begun, but before it's symptomatic. Early identification and treatment is really the goal before it becomes more symptomatic or severe disease. Example here is check a body mass, BMI, at every well check to identify individuals who are overweight or obese. Another example of this is, for example, our screening tests that we can do in our clinic. One of them being a colon cancer screening, such as a colonoscopy. Let's say 50-year-old individual, male, no symptoms, no weight loss, feeling well, but just wants to get checked for cancer. And we can offer a colonoscopy. They can look at a lesion and treat that lesion before it becomes symptomatic. And that's something where we're treating something before it gets worse. Another level is our tertiary level, which is an intervention or service implemented after a disease or injury has established. Its main goal is to prevent sequelae or stop bad things from getting worse, essentially. The example here is help obese individuals lose weight to prevent progression to more severe consequences. And another example of this would be, let's say this colon cancer individual, we find it at a later stage, maybe it's already large enough to have symptoms like weight loss or blood in your stool, but it's only localized to the large intestine. Well, there's interventions that we can do, such as surgery or chemoradiation of some sorts, to prevent it from spreading to other parts of the body. And that's another example of tertiary, where we establish a disease, we know it, but we prevent it from getting worse, essentially. Now we talk about different types of levels. Let's talk about the recommendations and what kind of screenings we can offer and why do we offer them, essentially. So let's transition to different grades of recommendations. Different physicians will use different recommendations. Your primary care will get the recommendations from different sources, but I personally use with my patients in my clinic is the USPTF, the U.S. Preventive Task Force. And they give out different recommendations for different screenings, and they have different grades. So for example here, a grade A, the USPTF recommends a service because there's a high certainty that the net benefit is substantial. A grade B is that there's high certainty that the net benefit is moderate, or there is moderate certainty that the net benefit is moderate or substantial. And a grade C is there is at least moderate certainty that the net benefit is small. And so that's really the difference between A, B, and C. C being a small benefit, B being a moderate benefit, and A being a substantial benefit. Grade D is a service that there is moderate or high certainty that the service has no benefit, meaning the harm outweighs the benefit here. And then a rare occurrence, you get a grade I statement where there's not enough evidence to recommend for or against. So why does it matter? Why do we care about these things? Well, in a research based on the UT Health System and American Health Ranking, Texas itself ranks 34 in overall health out of 51 states. And this was done in 2017. And in 2008 and 2012, Texas ranked in 42nd and 39 respectively. So we have a lot of room to improve in our health here in Texas. Texas infant mortality rate is 23rd in the nation, about 5.8 or roughly around 6 per 1,000 births in 2017. So a lot of our babies are dying. Furthermore, obesity ranks in 43rd, and in women's health, 44th out of 51. So we got to care for our women. And localizing to here, our region, Northeast Texas specifically, we compare it to the rest of Texas, and we can also compare it if we just took East Texas as a whole and use that as a state and compare it to the other 51 states in the United States. So for example, here, heart disease. You can see that Northeast Texas has a higher rate of heart disease compared to the rest of Texas, about 33% higher rate. And if you compare Northeast Texas to the rest of the United States, if you consider it as a state, it's 49th. So there's only 2 other states that it's worse than Texas, the Northeast Texas in heart disease. That's a significant number. As you can tell, cancer, the next line, if you compare it to the rest of Texas, Northeast Texas has a higher rate, about 6% higher rate than compared to Texas. Chronic lower respiratory disease, which includes like COPD, 47th. Stroke is last. So East Texas has a high rate of stroke compared to the rest of the United States itself, or compared to Texas itself. And so this is why it matters. And I think taking in charge of our health and seeking a healthcare provider, we can reduce these risks. So let's take care of our women. What can we do? Talk to your provider. Talk to your physician about services that they can offer you. Using the USPTF guidelines, we can screen for breast cancer. They recommend every 2 years, but we can even do it every year and for certain individuals. And these individuals are mostly in the age 50 to 74. But again, you might not be in this age range, but talk to your physician. You may be qualified to get these tests sooner. I know a personal example. A friend of mine who has a grandmother who passed away from breast cancer. She never got a mammogram, and by the time they found it, it was late stage, it had spread, and fortunately she passed away. But we tested mom. We got her mammogram in time. We were able to intervene, and now she's still alive and cancer-free. So that's the benefits of early checking, and these are the services we can provide to our moms and grandmothers and other women in our community. Other things, we take care of women in all spectrum, even younger women, childbearing ages. One of those things is we check for cervical cancer screening, and that can be done with a pap smear. We start at the age of 21, and at age of 30, we can include an HPV test, a human papillomavirus, and you can start doing that every 5 years instead of every 3 years. And that's checking, again, for cervical cancer and viruses. In childbearing ages, we recommend folic acid to women who want to have children, and this prevents neural tube defect. Helps with brain development of the fetus and allows them to have healthy babies so they don't die off at such an early age. Other things, our elderly women, we can check for bone health, and one way we do that is doing a DEXA scan, which is checking for osteoporosis, osteopenia. It's checking for the density of the bone, usually in the hip and back, your vertebra. And by catching osteoporosis early, we can intervene by giving medications, different treatments such as bisphosphonates to increase or maintain bone health, preventing fractures. And ultimately, by preventing fractures, we save their lives and increase their mortality, allowing them to live longer and have better quality of life. So let's talk about cancer. What can we do and what can we offer? There's many things that we can do. One of them being colon cancer screening, like we talked about earlier. The USPTF recommends that a grade A for 50 to 75, and we can even start as early as 45. And so talk to your primary care physician. They can refer you, and they can offer different types of tests for this. Most people just know the colonoscopy, but there's several tests that we can do out there now. One being a yearly stool test, which is the high sensitivity guaic fecal occult blood test, or FOBT, fecal immunochemical test, the FIT test, or a DNA test. And if you combine the stool DNA and stool FIT test, you can get that every 3 years. And obviously, the one that I always recommend is the direct visualization test, which is your colonoscopy. We can refer you to a local gastroenterologist, and they can perform a scope. And if they see any lesions, most of the time they can take it right then and there, which is I honestly recommend. But not everyone wants that, so come talk to us. We'll find something for you. Other cancers, we can do an annual screening cancer for lung cancer. For individuals who are age 50 to 80 who have a 20-pack year smoking history and currently smokes or have quit within the past 15 years, we can perform a CT scan, a low-dose CT scan, and check once a year for lung cancer. So let's get into the heart disease and stroke, which are what we talked about earlier, a really bad problem here in East Texas. Come talk to your local physician, because what they can do is calculate your 10-year risk factor for getting cardiovascular events such as a heart attack or stroke. One score that I use is the ASCVD, the atherosclerotic cardiovascular disease score. And this calculates your 10-year risk of heart disease or stroke using the guidelines published by the American College of Cardiology and American Heart Association to determine your risk. Most of your physicians have some form of tool like this. There's a Framingham score, different types of tools, but they can calculate your 10-year risk factor. And it's important because we can recommend different types of medications to prevent or reduce your risk of stroke. So for example, the USPTF recommends adults age 40 to 75 with no history of cardiovascular disease, one or more risk factors such as diabetes, hypertension, high cholesterol, and a calculated 10-year CVD event risk of 10% or greater. And that's the ASCVD score I was talking about earlier that they can calculate. And we can give you a cholesterol medication, a statin, such as Lipitor, Crestor, atorvastatin, things of that nature, to help you reduce your risk of having a heart attack or stroke. But talk to your doctor, because there's obviously different side effects for these medications to see if this is the right medication for you. Another medicine is low-dose aspirin. We recommend this in adults age 50 to 59 years with a 10% or greater 10-year CVD risk. And so low-dose aspirin is a small blood thinner. 81 milligram, not your full dose aspirin, can reduce your risk of heart attack and stroke. But again, I encourage you to have this conversation with a primary care physician, because there's side effects of this medication, such as bleeding. And so it might not be the best medication for you, but your primary care physician will definitely recommend something for you. Other things that we can do to decrease heart attacks and stroke. Well, controlling your hypertension and diabetes, or checking for hypertension and diabetes. The USPTF recommends screening for prediabetes and type 2 diabetes in adults aged 35 to 70. And one way we can do that is getting hemoglobin A1C, which is a blood test. Checking your blood pressure. Anytime you come into our clinic, we're going to check your blood, and if it's out of range, we'll recheck it, or even intervene and give you some recommended medication for you. But that's just, we don't ever force you to, but it's a conversation you have with your primary care physician. Chronic lower respiratory disease, and one example of this is COPD. The number one way to do that is prevent from happening in the first place, or prevent it from progressing. So we recommend tobacco cessation, and if you're ready to quit or want to quit, have that conversation with your primary care physician. There's so many things that we can do now. There's different tools. We can recommend counseling, support groups. There's even medications such as nicotine, Chantix, Wellbutrin, all those medicines you've heard through the commercials. Your primary care physicians can definitely help you with. Again, we can decrease your risk for heart disease and stroke. Just have a conversation with us, and we'll try to take care of your health the best we can. We have a few questions here today, and I'd like to take this time to address them. What is the difference between diagnostic and preventative screening, I'm assuming? Yes, so there's a difference, and a major difference. So diagnostic and preventative, the best way I could do this is give an example. Diagnostic is more if we already have a symptom and we're trying to diagnose it and treat it, versus preventative is something that is not there yet. So for example, somebody like colon cancer screening, for example. Let's say a patient has symptoms of colon cancer such as bleeding or weight loss, and we want this patient to get a colonoscopy. Even though colonoscopy can be a screening, at this point, because the patient has symptoms, it's more of diagnostic, versus let's say someone has no symptoms, they just want to get their health check and want to make sure they don't have any cancer. So no weight loss, no bleeding, nothing. We can offer a colonoscopy, the same test, but at this point, this becomes more of a screening and not diagnostic. Second question, are all wellness exams covered by insurance? I would say majority is covered by major insurances such as Blue Cross, Blue Shield, Aetna. Especially the USPTF grade A and most of grade B, most of those will be covered by your insurance. However, there's many different types of insurance in the world, so it's hard to catch everything. But the best way to do it is call your insurance company and see what should be covered for. And we can offer most of these USPTF grade A and grade B services at our clinic at UT Health Equipment or at our facility with UT. Third questions. Do young people need to do preventive screening? I would say yes. As the data shows, the earlier we can prevent things from happening downstream, the better we will be and the healthier we will be. We can offer screening once a year for individuals who are otherwise healthy, checking for blood pressure, diabetes, cholesterol, things that may lead to hypertension and eventually lead to heart attack and heart disease or strokes. So there's no one set time to come get checked. I think once a year, once every other year for young individuals would be appropriate. But if you're worried about your health, come see us anytime. Well, thank you all for joining me today for this presentation on the importance of preventive medicine. I'm Christian Ferrer, and I'm at UT Health Equipment. Thank you.
We hope you enjoyed the presentation today. If you would like to schedule an appointment with Dr. Ferrer, please call 903-763-6220 or visit uthealtheasttexasdoctors.com. Our next virtual seminar will be announced soon. Follow us on Facebook to stay up to date on upcoming events and seminars. Thank you for joining.